Welcome back to my channel, Sense of Tumor. Today, my guest is someone very important to me, to whom I owe a big part of my recovery. Professor Fadi Nasr is a Lebanese oncologist specialized in hematology. In other words, he treats cancers and blood-related pathologies. In 2016, on a Saturday night at 11 p.m., Dr. Nasr admitted me at the ER of Hôtel Dieu de France, where I took my treatment for the 2 following years. I remember that night so well. He took my hand and held it close to his heart and said, "Hand in hand, we will overcome this. Just consider yourself to be a broken car and I'm the mechanic ready to repair you." And I thought to myself, well, here's somebody with a sense of humor. We took it from there. Dr. Nasr accompanied me through my darkest times. He witnessed my spectacular pains and complications, but we got through it. He was there literally in sickness and in health. Literally. He was there when I first launched my book, Sense of Tumor. He was actually the first person I ever signed my book for, and that's very special. Unfortunately, a few years ago, I heard some devastating news. I was hoping it would be a rumor, but it wasn't. Dr. Nasr was diagnosed with stage 4 metastatic colon cancer extending to his liver. Today, we will go through his journey to understand what it feels like for the doctor to become the patient. Dr. Fadi Nasr, you are one of the most requested oncologists in Lebanon. You've treated thousands of patients, myself included. Before we move on with this conversation, before we proceed, I would like to say a big thank you for all the times that I called you at night and you stayed up all night just to make sure that I was in no pain.
Raquel, thank you very much. You are a good woman and a nice patient, and I'm very happy for you that you have a very bad disease. And look at you, you are doing well, everything is fine, and you have the sense of humor and the sense of humor. And this is very important for our patient.
Thank you so much, doctor. And seriously, I always say that the team gave me the energy and the spirit to keep going. Like I can still hear you calling my name, Raquel, good morning, Raquel, before even opening the door. And that was one of the best times. I remember hating Tuesdays and Thursdays because you wouldn't show up. I would
Thank you,
always
Raquel.
get to hear your voice and your good energy.
And like you are saying, the team is very important. So I think it's not only the doctor, but I think all the team is important, the nurse and all the details in the hospital are very important.
The title of this episode is When the Doctor Becomes the Patient. So I have a few questions to ask you about that. And to begin with, they say that doctors are kind of invincible. They think that they are immune to illness. How did you feel when you heard about your diagnosis? Tell us a little bit more about that.
No, we are mortal, so this is important, and I know about this. We are invincible, and we know about this, and we are not immune, so everybody can have the disease. So yes, I have the cancer, so I'm not ashamed about this, and all Lebanon or all my entourage know about this, and I know that many of my patients who are coming to see me who don't know me or the patient who I know about my illness, and I'm not ashamed about this. So yes, I did pass a hard time with the disease. I pass it like you with positive feeling, and that's what I tell my patient always, that we have to be positive, even though in a part of my illness it was very dangerous, and I know it was. I have a stage 4 disease. I will tell you my story. But how did I know about this? It's by chance. I have a stone in my kidney, and it was Christmas, and we have to travel to Philippines. So I was checking about my stone to see where is the stone and if everything is fine. And I discovered by chance that I have a metastatic disease to the liver. So I have two nodes in my livers, and we checked from where they are coming, and we did know that they are coming from my colon. So I didn't feel anything. I was doing fine, and I
Yeah, I was
discovered my
going to ask
disease
you
by
actually.
chance.
I was going to ask you, so doctors, you always tell us to keep checking, to early diagnosis, look out for symptoms. Like, how come this went unnoticed? How come you were just you didn't know, and it was stage 4. So
I have like at that time almost 50 years old. I was checking my PSA because what we tell our patient is to check the PSA and to check to do colonoscopy at 50 years old. And all my family know I don't have a family history. So I was planning to do a colonoscopy like when I will come back from Philippines for checking. And because I'm a very, very busy person, also doing colonoscopy is very complicated in my lifestyle. So I didn't have any symptoms for my disease, and it was discovered by chance, like I told you.
this is insane. It's crazy. I mean, it makes me even more scared of cancer right now because
It's
how
fine. It's positive. Look, I'm doing this like by chance. I discovered it, and if I have a problem like in another country with like this, it would be a very complicated thing. So I stopped my my Christmas holiday. So
oh my God.
the plan to go and make the holiday with the family out of the country. And the second step was to do the good diagnosis, the good staging, and proceed with the treatment. So
Wow.
always person did ask me, Raquel, what did you feel? How did I did feel like I'm a doctor. I'm a doctor in this specialty. So the first thing, yes, it's a metastatic disease, so it's bad. The other thing, what we have to do and what we can do. So I proceed with what we have to do, and I was very like positive, and I know. And the most important thing in life is to know that we will die. So and to be aware that we are a mortal person. So if we are aware about this, it's simple. So we will die one day of or another. The most important thing is to die in likely good shape and knowing that you did everything well, and I'm a good a Christian. So this is help a lot when you are a believer that when you die you will continue. So in some somewhat somewhere. So this is very important to know that it will give you a positive approach that in this life it's like a journey. Things get simpler and like me positive.
This is something I always wonder about. I wonder if people knew, like, we know we're gonna die, but if we knew when we were going to die, would we do things differently? Would we do the things that we are doing in a different way, in a more enthusiastic way, in a more passionate way? Uh, I don't know.
In my case, Rachel, what changed before and after was, so what changed before is was I was doing a mission in oncology like a doctor, and
Yeah.
now I'm doing a mission like I said in Arabic we say risale, or
Mm.
like my patient. I am a patient now, so I look to my patients like the same way. It didn't change.
Yeah.
So because you know me, in the past I treat patients like in a mission, and now it's a real mission. So it's not. It's a real mission that I'm having, even though that I don't know how many. At the diagnosis, it was stage 4, like I said, disease. And in stage 4 in colon cancer, it's a life-threatening disease, and people can live like the median survival of these patients is between 20 and 30 months. And I know the details. I treat these type of patients. I treat them very well, and I know that I don't have perhaps many time to live, and I didn't change my life. What it did change is the philosophy. So the philosophy is I'm getting nearer from my God. So I pray more than before, and I hear more things. Like I discovered some books or some people like Maria Valtrotta, who give the story of Jesus like every day, and I like this hearing this story of this woman. So this is what it changed, like in my nights or in my weekends. I read more philosophic books, but in my day-to-day practice, I am every day, like every day. So I go to work, even though I did the surgery. It was a big surgery for the colon and for my liver, and I did chemotherapy like all my patients. And I did have the complication of chemotherapy, like whatever you want, acne, diarrhea, nausea, vomiting. But I didn't change my everyday. So for every day I go to the work at 7 o'clock. I will come back, late at night with my patient. And
That's
when the
insane.
patient tell me it's complicated, you don't know what I feel. So I tell them, yes, I know what you feel
Yeah,
because I
well,
have
and
the same problem.
you know,
So when I tell the patient put likely a cat, so no, I cannot put a cat. It's impossible. So I tell them I have a cat. Look at my my cat. So I put a cat like you, a catheter like you. So and the patient, when they see me that I have their problem, so they
yeah,
are not anymore afraid or ashamed that
yeah, it's true.
the doctor that who are treating them is like them. And the
Mhm.
other problem I see in my patient, they were afraid, some patient, to continue with me. So they will say, perhaps this doctor will die. So if he will die or have a problem, so how I will continue with them. And even with some doctors who work with me or in the same specialty will tell if they have their patient. So Dr. Nasr is an excellent doctor, but who know how much he will live, and it's better not to go to him because he have a lifetime.
But what
I'm
the
not,
hell? No, no, no. I
uh,
don't want to hear this.
no, why
Kidding.
not? It's
Because
normal.
no, because
And
at
and
the end you're doing
the
what
story.
you love doing, and I know.
No,
I
no, this is
remember.
no, this is real life, and we have to hear about real life. And real life also said that some of these doctors did die now from problems like from
Yeah,
the
COVID.
explosion or the COVID. And this is important to know about these stories. Nobody knows when your time is coming. And like you are living, Raquel, it's very important to live every day like a new day and a happy day.
Yeah.
And of course we have problems. It's for sure every day have its problem, but if we resolve the problem of every day, it will be simple, and the next day will be also a happier day. So this is very important to live day by day.
It's true. And I can see your positivity right now, and the way you're saying that, the way you are uh, behaving with the patients, it's even more. I can't even imagine how it could be more positive or more compassionate, because now you feel exactly what they feel. And as your patient, as your previous patient, I mean, I remember how sweet and warm and really considerate you were, and it felt as if you were really feeling what I was going through. And now you are literally feeling it. So it's incredible. I remember you staying up all night when I had this complication after the injection for my immune booster. So you stayed up all night, and it felt as if the next day when I saw your face, oh my God, I looked at your eyes, and they were like dark, and you didn't sleep all night because you were up with me. And that was, to me, it was just everything I could ask for, and even much more than what I could ask for from my oncologist, to be following up with their patients so closely. And now you feel it physically. It's not just because you're a good person, because you are a good doctor and you connect with your patients. It's because you physically feel it. I can't even imagine how it feels to be in your shoes right now.
It's difficult, yes. It's difficult to be a patient and a doctor in the same time because you know what's happening, you know the complication, and it's good
Exactly.
in the same time because you know how to treat yourself,
Yeah.
and you know that it can be very dangerous and you can die from this. So what I did is, yes, I did the surgery, I did the chemotherapy, because many of my patients will did ask me or did come to me saying, did you do chemotherapy like you are proposing for us? And I said, yes, I did
How come
chemotherapy.
you didn't lose your hair?
And in colon cancer, the treatment that we give don't you don't have loss of your hair,
Mm,
because not all chemotherapy you will lose your hair. So
yeah.
in the colon cancer, we don't lose the hair with the chemotherapy. But of course, I did have many complications like diarrhea, nausea, vomiting, acne. So on your face, you have the sign of the chemotherapy, not losing the hair, but like the sign of acne. And I was not ashamed doing this. And you have the eyes of the other person saying haram.
No,
Uh,
no, no,
what
no. I don't think anyone looked at you saying that. No, بالعكس. We were looking at you, we were saying, how is he still walking, going to his clinic, waking up at 7
yeah.
and or 6 or 5? I don't know what time you wake up, but you're there at the hospital the whole day, and then you finish from the hospital, you go to your clinic, you have your patients. Like, we were looking at you, we still are, and saying, wow, this guy, we should make a statue of Dr. Fadi
No,
Nasr,
no.
because I swear I say this, and it's coming from the bottom of my heart. I swear. And there's so many patients, we always talk about you behind your back, and everyone has the same opinion of you. My next question is, well, you kind of answered my next question. So when you said that because you're a doctor, you understand exactly what's going on with you. So here's what I want to know. Okay, you have all the information, all the scientific information, and all the knowledge about the cancer and the side effects and how dangerous it is. Did this make it easier for you to deal with it, or did it make it harder because you know about it?
When you have a stage 4 disease, you don't know what will happen next. So you don't know if you will respond to the treatment. Like any patient, you don't know what will be the effect of the treatment. It can be positive or negative, and you have always the problem that you can die anytime if you don't respond to the treatment. And
Yeah.
this is very hard. I know this is very hard. But the most important thing is not to be afraid of dying. This is a very big problem. I am a Christian, and even our God, so Jesus did have was afraid of dying, and it's very hard what will happen next, or what it will be next, and this is a big question. And when you are like a believer that next is positive, if you are fine with yourself, so things will get like simpler, I think. But the big problem is I didn't know if I will respond well to the treatment, if can do a surgery. And in my story, yes, I did the surgery. I did have a good surgery. The things were gone, so the liver metastasis was treated. But like 1 year after this, I did make a relapse. So another time, the disease come back, and the relapse was in the liver and in the lymph node. So this is another time, and this is another problem for me, like for you. So when you have the disease, you have the leukemia, and then everything went well. And at one point of time, I will tell you, I'm sorry, Rachel, the disease is coming back, and you have another time to take chemotherapy, and this time it will be very difficult, because we know the disease is more resistant, and we did take the treatment, and you did respond for some time. But when the disease is coming back, everybody know that it will be very difficult, and things are getting more complicated, and getting to the cure is complicated also. And this is what happened to me. So I did have a relapse, and in the relapse, it get complicated. and we did have to go back and to do another time the treatment, to do another time the surgery, and I wasn't like very sure that I will things will get better. And alhamdulillah, like we said, things did get better. But like you, like me, at any moment, I can have another time a relapse, and another time the disease can come back. And in between this time, we have, like you are doing, to appreciate every moment. And this is very important. So, this is the difference, like you told me. If you don't know when you will die, or you know likely when you will die, so that every moment have to be appreciated, and not like little things make you mad and whatever. So things are more, yani, little things are not important
Yeah.
more, and
You
big
start
things for
discarding.
you, like staying with the family, like things, your life in the details will change.
Yes, it's true. Everything you are going through changes when you know, okay, I have a life-threatening illness. So we are both in this together. Um,
Yes.
when you have a life-threatening illness, you start wondering, okay, so I might have a year, 2 years, 5 years. I can't plan things like, okay, in 10 years I want to accomplish this, or in whatever. You stop thinking about it this way, and you start saying, today this is what I'm going to do.
So it's
So
better. So living day by day, I think it's a better thing to
true.
approach
And I think
life.
you reach your goals easier and faster when you start living day by day.
Points that I want to stress for patients who have cancer like me. So one, yes, do the prevention is important. Sometimes you don't feel anything. So for women, do your mammography from the 40 years old every year. For men, do PSA from 50-year old and higher every year. So this is very important. And even though you have the disease, there is treatment now, and the treatment can do harm, it's for sure, but it can improve your quality of life, it can improve your overall survival, and you can live more with with the people that you love. And this is very important, that, like we said, every minute in your life is important. So be confident and live every minute positively. This is very important. Every minute in your life, you have to live it positively, that you, when you die, you will say that I did live a good life and a happy life.
Do you have any fact or story that you'd like to share with us? I'm sure you have many stories that happened to you as being a doctor and a patient at the same time.
So the stories that I have is many patients come to me who have colon cancer like me, and
Okay.
they did come. They are not my patients, so they did come to see me, to see how I looked, how I did take my disease, how did I treat myself, yes or no, or how I did react to the treatment. So every time I have a consult, like we are coming not to a consult like a doctor, but a consult like to see me how how I did live my disease, and it's make me like laugh, and I stay with them, and I tell my story, and to make a push for them to continue the treatment, and even though their disease is very bad, or I know that it will not at the end have a happy ending. But the most important thing, that in the time that they are living, every moment is important. So live it positively.
I think I look at you with so much loving eyes already, but as of now, I don't know, I'm melting. And not anyone would have accepted being here in your shoes today. So thanks really for joining me. We are just so lucky to have you with us. Thank you so much, Dr. Fadi.
Thank you, Rachel. Take care of yourself, and I am very happy to share with you my story. Thank you very much.
Habibi. I hope you enjoyed watching this episode. Don't forget to leave your comments below and make sure to subscribe to stay posted about upcoming videos.